Sorry. Okay, we're gonna go ahead and get started at 7 o'clock. Thank you all for coming. Just a couple things to say before we get started, maybe. We have a few upcoming events. Our Fall Frenzy Social hosted by Lily is gonna be on November 3rd. So that's not this coming Sunday, but the following. And we're gonna be having some like tailgate food, I think. We're gonna be watching the 425 game, whatever that game is. I can't remember who I said it was, but there is an NFL game on at 425 that day. And there is a costume contest. And I hear you might get a cool prize if you dress up. So you should come in costume. But other events, we have small animal rounds coming up on November 12th. I don't think the signups have been sent out for that yet. Actually, no, for a fact they haven't. Olivia's not here today. She's sick, so if you have any questions about that, you can message her or message me and we'll let you know. But just keep an eye out for the signups for that. And then for SAVMA, Daniela, do you want to talk about this?
Thank you for those that attended the meeting this past Monday. It was lots of fun. It was a really short meeting because they have a lot going on. Mock interviews are going to be on Thursday, November 21st. I'm going to try to keep it between 6 and 7 p.m., but it just depends on how many people we have signing up. I'm still having SAVMA members sign up to volunteer to be interviewers, so I'll let you guys know when signups for mock interviews are ready to be sent out. And then I'm also in the midst of planning a mixer for us to mix kind of with vet students. And that'll be on Monday, November 25th from 6 to 8 in Plum Hall. I will send out a little poll for food so we can kind of vote on which food we want. And then I'll send out more information on that too.
And that should be a really cool experience. I don't think we've ever really done anything like that before with the vet students, so be a really good opportunity to get to know some of them. And also I think for mock interviews, just want to let you guys know that for signups, it's probably going to be prioritized for upperclassmen, junior, seniors, which I know that sucks for some of you who are underclassmen, but you'll have a couple more years. We do this every year, so you should have another chance to do mock interviews. We just have a limited amount of people who have signed up SAVMA wise in order to help us, so kind of going to be limited on space for that. And then if you saw this in the group me, have a poll going right now for the design for our fall merch. We have 3 designs that Michaela came up with, and this is not the official order form. That's going to come out next week at some point. But if you want to fill this out so then we know which design people like best, this is going to close tonight after the meeting. So if you haven't filled this out already, go ahead and scan this real quick and you can get it filled out. All right. Just a couple general reminders. We do have the point spreadsheet up on our website. So if you guys want to keep track of if you are on track to be an active member for the semester, or just want to see how many events you've attended, you can go to our website. It's just the first one when you Google OSU Pre-Vet Club. It's like the Wix site. And if not, I think I have it linked in the emails as well. So yeah, and then if you just click on the points tab, then there's a link to the spreadsheet on there as well. In terms of volunteer events, I think we've been having a few issues where people sign up and then cancel last minute, and we get things happen, you get sick. But if you are gonna sign up and then just please only sign up if you know you're free and actually intend on coming. Again, if you're sick, I totally get that. It's not what I'm saying, but it kind of, creates an inconvenience for the people that we're volunteering with when we give them a roster of people and then only half of those people sign up. They don't have enough volunteers for what they were planning on. So please only sign up if you actually intend on going. But then last thing, dues deadline was right before fall break. If you have paid dues and you're not in the new due paying member group me, which is just the PVMA 2024-2025 group me, please let me or Emily know and we'll get you added into that group me. Does anyone have any questions? All right. Well, I will hand it over to Dr. Jennings then. Please give him a warm welcome. Slide.
Speaking of warm, I brought my iced coffee because I sweat like I got malaria. Probably didn't need to start with that. Thank you very much.
Thank you.
Well, good evening, guys. Thank you for having me here, and thank you to the club for having me and inviting me. My name's Ryan Jennings. I am faculty in the College of Vet Med. I'm going to talk a little bit about myself. They left it pretty open what I can talk about tonight, so I'm going to go through a little bit about myself, how I got to be a veterinarian and where I'm at today, a lot about veterinary pathology, and then we'll finish off with some cases that have a spooky turn to them because it's Halloween season. Anyone else like horror movies and stuff? I'm a sicko. I love those. Okay, my wife can't stand it, so I'm like down in the basement and watching horror movies all season. Okay, so disclaimer. So there will be images of like kind of I don't know how to say it. Gross stuff, I guess, a little bit of gross stuff. So if you're queasy or anything like that, no big deal. We have that's totally normal and okay. But I wanted to don't blame Jennings. Okay, that's all I'm saying. All right, so a little bit about my journey to where I'm at today. So how many people are like thinking about vet med but aren't 100% sure yet? Oh, damn. Okay. So I know everyone's going on to be okay. So you guys know you're on the rails for the track. I was kind of the same way. It was like since I wanted to be when I was young, I wanted to be a garbage man, and then the backup was veterinary medicine. So so I started. I'm from Michigan originally. I'm from about here. Any other Michiganders? Okay, yeah, cool. So I was a Michigan State, Michigan person, thank God. And I did my undergrad in Michigan State in zoology. That was kind of like the catch-all thing for a lot of people who were pre-vet. And then I went on to do my DVM there at Michigan State and graduated in 2008. Don't do the math on how old I am. Next, so while I was backing up, when I started at Michigan State, I kind of wanted to be a small animal practitioner. That's kind of what I thought I was going to do. And then I got kind of interested in oncology. So I wanted to do something specialization. And so the summer after my first year of vet school, I worked with I wanted to go elsewhere for a summer. And so they had a research program around the country at vet school. So you could apply to, they paid you a stipend during the summer and then you got to work there. So I went down to Auburn University because I wanted to go somewhere a little bit warmer. It was, it was very warm in the summer. And so I worked with a researcher there who happened to be a pathologist. I had no idea he was a pathologist when I signed up for it. And he was working on FIV research. And so one day he calls me down to the autopsy floor and is like, hey, we need help down here. So come help. And so strangely, I came down there and I was like, this is so much fun. Like pathology is so much fun. So it just happened. And from then on, I was like 100% on for pathology, which I know is not like the most popular probably sector of vet med. There are about 2,000 of us veterinary pathologists. But that's sort of what got me. And my whole purpose of saying that is it's okay if you're not 100% sure what you want to do. We have individuals that even graduate and then change their career path and stuff. So that's the nice thing about vet med. There's a lot of things you can do with it. And really you can evolve as you go along. So I was pretty sure I wanted to do pathology. So I did a residency in anatomic pathology at Purdue University. Those are 3-year programs. I'll talk a little bit about those as well. And then became boarded for the American College of Veterinary Pathologists, which is kind of like our umbrella organization that certifies everyone. After that, I'm a weirdo and I just really like school. Okay, and I wanted to do research. And so I pursued a PhD at Wake Forest School of Medicine. And the cool experience of that is I was taking my veterinary background, my pathology background, and going to a school of human medicine to do research in human models, animal models of human disease. And for me, it was not only a lot of fun learning how to do research, but it really kind of shaped how I look at our profession, veterinary medicine, in that, you know, you guys have heard the One Health term for things and how veterinarians are really critical to every aspect of medicine and the healthcare system as well. And then in 2015, after my PhD, I applied for a job here at Ohio State, and I did not think I was going to get the job at all, and I did. So suckers, yeah, still here. Okay, this is my cat I had to show. So her name is Daffodil. We call her Dilly. I just got her about a month ago, and she is perfect, and you can't convince me otherwise. So a little bit about what I do here. So I'll go into a little more detail, but my interest is in skin pathology. So we call that dermatopathology, skin pathology. And it's basically the study of diseases of the skin. And has anyone here worked for a practitioner and had a skin disease case at some point? Itchy dogs, right? Crusting skin lesions, hair loss, all those things. Some of the most common things that we see in veterinary medicine come through clinics. Large animal as well, so horses during the summer especially, a lot of allergic disease. They get infectious disease as well. And so there's a big need for that in veterinary medicine. And for some reason, I really enjoy skin diseases. And so we're going to focus on some of those for our cases there. But that's my interest. So a lot of pathologists end up choosing, instead of being like a generalist, they choose an area of interest that they kind of focus more in on. So some people focus on GI tract, some people focus on the brain. I happen to focus on the skin. The other thing I do, so part of my job is faculty, and I'll talk more. I teach, I do clinical work, which is pathology, and then I do research as well. And that's the fun part about being here at a university, is you've got all these opportunities to do sort of whatever you want. The current thing I'm doing that I'm super excited about is image analysis. So pathologists, basically our job is to recognize patterns, okay? Patterns of disease, patterns on a microscopic slide. And the cool thing about that is that you can actually kind of train a algorithm to do similar things. So you can teach it to learn patterns and then identify those patterns. And so image analysis is a big thing now in research. So basically scanning slides of tissue and then teaching the algorithm, so through machine learning and deep learning in this particular case, to identify certain things on there. And by training the algorithm really well, it'll count all those things. It'll tell you where they're at, how many there are. And in that way, it can be a really big tool for research. And my current research that I'm doing is anyone guys familiar with mast cell tumors in dogs? Okay, one of the most common tumors of the skin in dogs. They are malignant tumors, so it's cancer. And there's a proportion of these dogs that do really poorly with mast cell tumors. They go on to metastasize and end up causing death. And so I'm looking at lymph nodes of dogs with mast cell disease, and I'm training this algorithm to evaluate and count all the mast cells within the lymph node, as well as what their proliferative index is and how closely related they are. And so we're actually doing a prospective study with 100 dogs, looking at if we can find out any prognostic information. So prognostics meaning, can we link something in these images to how well the dog does long-term with survival and disease-free intervals, and looking at that. So I just wanted to plug that because it's really fun being here at a university, because they really sort of let you do whatever you want to do with regards to research. And I've come a long way from doing mouse research to doing this sort of thing. Okay, so veterinary pathology, basically like the study of the cause and the pathogenesis or the mechanisms of disease. All right, so I kind of term it as like, you try to explain things to your family when you go home, and they have no idea what you're talking about. And you're like, I'm a disease detective, which is basically what I am as a pathologist. The other thing is that disease is basically the foundation of medicine. Other than wellness, which are things like vaccination, other than wellness, everything in medicine is all about disease. Cause of disease, what's causing it, how to treat it, all those things. And so pathologists are basically at the front line of that in diagnosing diseases, and in some cases research into what's happening with that. And we do so at multiple different levels. So macroscopic, so what you see in the animal. So in the case of like derm path, it's like the skin lesions that we're seeing in those dogs. The microscopic, which is looking at things under a microscope, obviously, and then the molecular level as well. So there's a lot of additional types of diagnostic testing that we do that goes beyond even what you can see under a microscope, which is really fun. So the major roles in medicine, what we're used for, veterinary pathologists, probably first and foremost and most commonly for disease diagnosis. So a good example is dog comes into the clinic, he's got a mass on his back leg. The owner says it's been growing over the last couple of months. it's bothering the dog, and the practitioner says, all right, let's take off, surgically excise that mass, and then send it to a pathologist so that they can tell us what kind of tumor it is. And what kind of tumor will determine probably how you end up treating that. So if it's a benign tumor, then cutting it out will usually cure it. If it's a malignant tumor, then you start considering other modalities of treatment. So getting that disease diagnosis is one of the biggest things that we do, most common things that we do. The other role of veterinary pathologists, and I'll talk about this when we talk about industry, but is drug development and discovery. So in research in industry or pharmaceutical companies employ a lot of veterinary pathologists because we know about disease. And so a lot of the pharmaceuticals, medical devices, they start in animal models, and they need veterinary pathologists in order to determine, are there any secondary effects? Is it working the way it should? And so in that way, we play a big role in the development of drugs and medical devices. And then finally, the research into mechanisms of disease. So sort of what I told you, but we're really widespread. Any researcher using animal models on campus is probably working with a veterinary pathologist, either at some point or another, in order to identify what's going on in those animal models. So we know a lot about animal physiology and pathology, and because of that, we're really helpful when it comes to animal models of disease. This is Rudolf Virchow. He is considered the godfather of veterinary pathology, and he has a wicked awesome beard. Better than mine. So, so as anatomic pathologists, anatomic meaning kind of like, like looking at the body, we have three major kind of things that we, levels of evaluation that we do, the detective work. So think about it as the detective comes to the crime scene, okay, and he's looking, this is getting really dark. He comes to the crime scene, he's looking at what's going on there, looking for clues, okay, and they do a little dusting of prints, right? That's like, so the macroscopic, the gross examination is looking for clues around, and that's what we do with the actual animal themselves. And here is one of my colleagues doing an autopsy or necropsy on a calf. Then we look at things microscopically, and we call that histopathology. So basically take the tissue, make a tissue section of it, put it on a slide, stain it, and then we look at it under a microscope, which is actually really fun. That's basically the detective doing like dusting for prints or something like that, like finding those things you couldn't usually see. And then finally, we use a lot of molecular diagnostics, molecular meaning like beyond the cell level, so deeper than the cell level, looking for proteins, genetic material, etc. And that's kind of like them doing the DNA testing for whatever's at the crime scene. Again, this is a very dark analogy. Could have come up with something better. But in that way, I think that we're like disease detectives, going from start to finish. And we play a lot of roles as those disease detectives, okay? So we call autopsy or necropsy, both terms are fine, for the gross evaluation, meaning like the what you can see in the animal's body. We do that frequently to evaluate and try to identify the cause of either disease or death in animals, all right? And the two major kind of areas that we do that with, one, herd health. So for production animals, say there's a group of calves that have respiratory disease, okay? They want to know what's causing that respiratory disease. And so they bring in the pathologist in order to figure out what the causes of that. And so we evaluate it. Does it have pneumonia? Looking at the pneumonia, doing cultures, PCR, things like that in order to diagnose it. So in that way, we're trying to inform the practitioner in order to prevent the spread of that disease or try to mitigate that and help treat them. For companion animals, there's two roles really we do. Surgical biopsy is probably the most common. So the scenario I told you about where there's a mass on the dog and the practitioner cuts it off and they send it in to get a diagnosis. That's basically surgical biopsy. So we sit at a microscope, tell them what it is, tell them if they got margins, what the prognosis is, all of those things. And then we also do autopsies on small animals, so cats and dogs a lot at our hospital, and determining the cause of morbidity and death. All right, so unfortunately, it's common that someone's pet will die at home, and they're concerned about one, what caused the death, and two, could there be anything that could be affecting their other pets or something like that? So that's another role that we play. And then finally, in laboratory animals, as I mentioned, pathologists are really important for determining and looking at laboratory animals and, you know, mechanism of disease in people's research. All right, so there's really like three. So there's the umbrella of veterinary pathologists. And as far as careers, there's kind of three general sectors there. It goes beyond this. So I have friends that like work in government work. I have friends that work in like regulatory work. So, you know, like lobbyists and stuff. But for the most part, there's really three sectors of this, and I'll talk a little more about each of these. There's academia, there's diagnostics, and there's industry work for pathologists. Okay, so even beyond being just, so it's kind of like, you know, in veterinary medicine, that you have small animal, large animal, you can have exotics, etc. So there's kind of sectors of different work that pathologists do. So academia, that's what I do. I really enjoy what I do. I'm not going to sit here and say it's the best of all these three, but I just, for me, it's extremely fulfilling, especially the teaching part. But so these are university-based positions. This represents a good proportion of the pathologists out there. They really have three roles. They do diagnostic pathology. So I work, read biopsies. I do autopsies with our residents here at the college, especially for the hospital, veterinary medical center. We also teach, so veterinary students in the DVM curriculum. So maybe I'll be seeing some of you sometimes. We teach, we have a pathology training program. So we train people who will eventually be pathologists as well. It's a lot of fun. And then we train graduate students in research programs too. And then, as I mentioned, oftentimes we're able to do research, and that's another kind of area that's really enjoyable about academia. So diagnostics, I would say, you know, a very big proportion are in diagnostics as well. And has anyone heard of IDEX and Antec? Those, okay, so pathologists work at those companies. As you can imagine, you know, you've got thousands and thousands of practitioners sending samples in every day to these laboratories, and so they need pathologists to read out like cytologies, blood smears, and biopsies as well. So that's a big employer sector of pathologists as well, and the majority for anatomical pathologists are going to be reading biopsies. So they provide diagnosis and prognostic information for the clinician with that. And then finally is what we call industry or pharmaceutical companies. So basically evaluating animal models. The company wants to, you know, the start to finish is really complicated of a pharmaceutical company, but they basically, you know, their chemists identify a molecule that might be helpful for treating some disease. Okay. What they then have to do is, one, make sure that it works, two, make sure that it's safe. And in order to do that, they need to use animal models first. In many cases, at least, they're looking at other ways to do this, but they need to use animal models for FDA approval. Ultimately, they want it to be effective and they want it to be safe. Okay, and so this is the way that they sort of make the case that these drugs are effective and safe, by using animal models. In order to evaluate those animals, they need veterinary pathologists, because we know what mice are supposed to look like, what the normal is, what the changes mean. And we're kind of scientists too, as veterinary pathologists. I mean, veterinarians are scientists, but it's really exciting. So I'm not in the sector. I have a lot of friends that are, and they basically work in these teams of biologists, chemists, biochemists, businessmen, you know, like business people that are working together as a team in order to bring this molecule up from you know, the start all the way to production. And it sounds like it's a really exciting path. It's also a very, very lucrative sector of it. I'll show you guys the numbers for that. Okay, so veterinary pathology, it is divided. I'm not going to talk about clinical pathology much, but you hear this, so anatomic pathology and clinical pathology. And the majority of pathologists are going to be anatomic pathologists like Jennings. Okay. This is kind of like the general percentage division of those careers. So about 30% of pathologists are in academia. About 30%, 32% are in industry work. and then the remaining are diagnostic and others. So this is I think it's worthwhile to show this sort of thing. The latest salary survey for these different sectors are shown there, and the industry is very lucrative. A lot of people want to go to industry right now because it's extremely lucrative, but it's a good pathology is a good gig. Okay, that's my pitch for pathology too. I have a really good work-life balance. I make a decent paycheck, and I really love what I do. So being a pathologist, I have a lot of friends. So my wife is an equine veterinarian. She's phenomenal. She's like the best human being I've ever met. But at the same time, she has on-call once a week. Okay, she has on-call over a weekend once a month. And Jennings doesn't want to do that. Okay, so pathology is kind of a good gig when it comes to hours of work and quality of life too. That's something you'll think about too down the line. You know, once you're in vet school, once you're getting to the point where you're trying to determine what you want to do with your career, like your work-life balance and what you want that to look like is really important. So how do you become a pathologist? Let me see where I'm at with the one. So one, veterinary school, which it sounds like all of you guys are going to be applying for. Who's applying this year? Who has applied this year? Okay. Ooh, good luck, guys. So veterinary school, and as I mentioned, you will eventually figure out what you're interested in. Okay, and you figure that out through exploring things. I was kind of like one-track minded with what I wanted to do for the most part. I would encourage you to explore. Once you get into vet school, explore everything. Figure out what you like, what you don't like, because what you start with when you enter and what you think you're going to be oftentimes doesn't always look like afterwards. And you only figure that out if you kind of explore things. So after vet school, there's a residency training where people go for 3 years, and then they'll graduate from that program, take boards, and then once they pass boards, they're officially a pathologist. Our college actually has what we call a combined program where our residents also pursue a PhD research training at the same time. It takes a couple more years for them, but they end up graduating with board certification and a PhD as well. And the PhD is, for individuals that really want to go on and do research, whether it's industry or in academia for that. It's actually probably the minority of pathologists that go through training. And then passing the boards, and then you get a job. Okay, be just like Jennings. All right, we're gonna stop there. Any unanswered questions about veterinary pathology? Yeah.
How much new people do you need coming into the field of pathology?
Oh, good question. So basically, what does the job market look like down the line for pathologists? So it's a little bit dynamic. I would say in general, it's currently inflating the number of pathologists that we need. I will say things like AI and image analysis have the potential to replace some veterinary pathologists, especially in diagnostic positions. For example, there's a lot of really common tumors that have a very common pattern to them, and you can actually teach the AI to diagnose that. And so if you can do high throughput type of biopsy reading with that, and they look at that in human medicine as well. So there's a chance that there might be a little bit of contraction with that coming up down the line, but that's probably a few years down the line. And I think that, still the value of pathologists are in the fact that, our scientific mind and understanding of mechanisms of disease. Oh no, is this bad? You're like, it's not good. Do you need me to log in or anything? Okay. Did you have a question back of the room?
Just wondering, I know there is how much position you are, but how much travel is involved?
Good question. It definitely depends on the position. I will say, I was starting to, back in 2018, 2019, I was starting to get asked to travel more, to speak and stuff. And then the pandemic happened. I was supposed to speak in Australia and they canceled it. And so since then, a lot of that stuff has moved to Zoom. So travel is definitely less with that. I would say one sector where they travel a lot. I have friends that are in industry. and they travel internationally because some of these pharmaceutical companies